Today we learned 2 Texas residents or passengers on that cruise ship that's experiencing a deadly hantavirus outbreak.
And the Department of State Health Services announced today the 2 returned to Texas before that outbreak was identified.
Capitol reporter Dylan McKim shares what we know about those 2 and why experts say the hantavirus is not as contagious as the coronavirus.
The Department of State Health Services announced Thursday that 2 people from Texas who were aboard the MV Hondius are not experiencing any symptoms and did not have contact with a sick person while aboard. Each person agreed to monitor themselves with daily temperature checks. The agency did not share which part of Texas the 2 live in. The Texans were among 24 people who left the ship after the first passenger died, but before authorities identified a hantavirus outbreak. In 2024, the National Institutes of Health identified the hantavirus for potential to cause another pandemic because there is no vaccine.
So we want to have things ready.
Dr. Kartik Chandran is part of a consortium of researchers looking for medicines and treatments for hantaviruses. Chandran said the specific type of hantavirus impacting the cruise ship is not known yet, but the assumption is the Andes virus, which can be spread from human to human. But the researcher says it's not as transmissible as COVID-19.
In general, it appears that there has to be close and prolonged contact between people.
Chandran said relatively little is known about the hantaviruses because only a small group of scientists are studying it. But at this point, the researcher does not believe there is a threat to public health.
I mean, there's certainly no reason to be alarmed if you're nowhere near the cruise ship.
In Austin, I'm Dylan McKim.
The Centers for Disease Control and Prevention said the viruses are mainly spread by rodents. The symptoms to look out for are fatigue, fever, muscle aches, headaches, and nausea.
And going in depth, doctors will be on the lookout in Travis County after leaders announced the first reported case of measles since last year. The county says the person who is sick is not vaccinated and became exposed while traveling internationally. That person visited St. David's Emergency Center off of 183. This was on Monday of this week between 11 a.m. and 1:30 p.m. People exposed are being contacted as measles is highly contagious.